in botany from the University of Hawaii in 1979 and his PhD in botanical sciences from the University of British Columbia in 1984. He has worked in ethnopharmacology and ethnobotany for over 20 years and has done extensive field work in the Peruvian, Colombian, and Brazilian Amazon. Dr. McKenna currently works as a scientific consultant to clients in the herbal, nutritional, and pharmaceutical industries, and 2 years ago he accepted a part-time appointment as senior lecturer at the Center for Spirituality and Healing, which forms the core of the integrated medicine program at the University of Minnesota. Dr. McKenna will discuss Dr. Ono's recent research findings on cavalactones and on cavalactones. So without further ado, give Dr. McKenna a leg.
Well, thank you. Always happy to be back in Hawaii and have a chance to see my friends. And whenever they give me an introduction like that, I always wonder, who is that guy? He sounds pretty interesting. I'd like to meet him sometime. But today I am a little bit, I feel a little bit funny because I'm talking about someone else's research, and it's always difficult to accurately represent someone else's research, especially when you have sort of a shaky grasp on just what it is they're talking about. So, apologies to Dr. Ono for any mistakes I may make. I'm sure that he could explain this much better. What I'm going to try to do in the 45 minutes or so that we have is to explain his work to you as well as I understand it, which is not perfect by any means, but it is interesting and worth talking about here, as it may represent may shed light on some of these kava liver toxicity issues. And some possible solutions as well. But I couldn't resist putting in my own sort of spin on it initially, and so I guess we can talk about that. Now, to make this change, there we go. Okay, well, this is really old news. Everyone in this room knows what kava is. It's a beverage prepared from the roots, usually of Hypermethysticum, and it plays a very important social and ceremonial role throughout Polynesia, and particularly as a social lubricant. It's a relaxing, calming beverage, fosters camaraderie, conversation without causing cognitive impairment or belligerence or any of the kind of things that we find with other social beverages such as alcohol. And there is a saying that with kava in you, you cannot hate. And many people are familiar with this, and I wish some of our world leaders would get familiar with that idea. But it's a benign beverage as traditionally used, and it has been traditionally used for centuries by oceanic peoples. The effects are anxiolytic. It produces a clear, calm state of mind. And it first came to the attention of the West really with Captain Cook's explorations. Its use was first reported in 1777. And since then, it's grown in popularity throughout Micronesia, and then now is the ceremonial and the social beverage of choice, much like coffee is in our culture. It's hard to conduct a business meeting or any type of negotiation or a social event without kava. It's just part of the fabric of life. So this is a example of a traditional kava ceremony in Fiji, and some of the beautiful carved kava bowls, of which there's a wonderful example back there, I think modeled after this one. And I'm sorry, the quality of these. Anyway, I may have skipped a slide here, but we can get on to the. Well, as you know, the active principles of kava, among many active principles, are these kava lactones, which are these aryl ethylene alpha pyrone derivatives, for whatever that means. They're non-nitrogenous compounds. They're not alkaloids. The main constituents are not alkaloids. And there is about 17 kava lactones have been identified in kava, but 6 of them are major: kavane, methysticin, dihydrokavane, dihydromethysticin, yangonine, and desmethoxyangonine are the 6 main constituents of kava. And they have multiple activities. They're sedative in higher doses. They're excellent muscle relaxants, anticonvulsive type effects, and they're also euphoriant, and that's the reason that the beverage is consumed, because they produce a sense of well-being, a calm state of mind. They make you feel good, and they produce a slight euphoria. And as many of you already know, and I imagine Dr. LeBeau will be talking about this more in detail, but kava has many chemotypes, many chemical races, and the races, the types, are based on the ratios of the various kava lactones in the roots. And they are one of the few examples where a traditional cultivar is determined and classified not based on its appearance or other qualities, but actually on its psychopharmacological properties. But the compounds here, the 6 major compounds, are arbitrarily assigned numbers, 1 through 6, and the drinking kavas, and then the chemotypes are defined on the ratios of these different numbers. And the best drinking kavas have a chemotype of 4, 2, 6, and then some other, and then the last 3 I've just shown asterisks here because it's the first 3 most abundant components that determine the drinking quality of the kava, and those with primarily kavane, followed by dihydrokavane, followed by methysticin, are thought to be the best drinking kavas. They give the best euphoric effect. And kavas are valued which have high levels of kavane primarily and lower levels of the dihydromethysticin, which has more of a sedative and perhaps a bit of a cognition clouding effect. And kavane is probably the primary euphoriant, and it is an emotional, it causes a stabilization of feelings, it stimulates the ability to think and act, it causes an emotional leveling, I guess you could say, and it causes muscular relaxation. So it has all of these effects, and altogether is, you know, quite a pleasant thing. Now there are reports of adverse effects of kava in a traditional context are relatively rare. One that has been known, is well known in the literature, is this kava dermopathy, which is a consequence of heavy consumption of very long-term and excessive, or at least heavy consumption. It's a yellowing of the skin, and the skin will turn scaly and yellowish if you consume a great deal. And there's actually, the skin can look quite reptilian in advanced cases. But it's not a life-threatening condition. It's thought to result, I believe, from the flavocavanes, which are highly yellow compounds that are in the kava roots. And if you stop drinking kava, it goes away. And it's not a threat to health. As far as anyone knows, it's not maybe aesthetically appealing particularly, although in some cultures, if you can afford to drink enough kava and to display this condition, it's considered a status symbol in some ways. But beyond this, there have not really been long-term adverse health effects of kava that have been noted by public health organizations in the Pacific Islands. And they do monitor these things, and if there were, for example, higher levels of some disease attributed to Kava, liver disease and so on, it would be likely to show up in public health statistics because in many of these societies, women as a rule do not drink Kava, well, men do, or women, I don't know if those social strictures apply now strictly, but women tend to drink less at least. And so if men were particularly prone to liver disease, you would think this would show up in the public health records. Yes. I won't guarantee I can answer it.
Well,
yes.
Kava itself per se may not be particularly dangerous in a traditional context, but the water that it gets mixed gives cause to diarrhea and a lot of other type things. Has there been any correlated research to that?
To the traditional.
I mean, I am always wary in certain traditional situations. I look and see whether. And the other one that concerns me is that there is latent tuberculosis in a lot of those islands, and they continue to pass the time. Has anybody looked at that?
I am not qualified to answer that question, but
Okay,
maybe
just
Dr.
putting it
Laveau
out
would.
there.
What is your experience with it?
Well, I think the hygiene is a major problem throughout the Pacific, and yes, it's true that the water is not very clean, and sometimes, and if you share cups, you can share viruses via the saliva. Pneumonia, tuberculosis are a problem in Kava bars. Definitely, yes. But I think this is a major problem in the South Pacific. But I think it is related to the fact that these are developing countries, poor countries, let's say, and therefore this is the way it is. But it's not related to Kava because they have the same problem when they cook. Other sorts of.
It's the ritual.
Well, I think it's more related to the hygiene in general.
Right.
Okay.
It's not an adverse drug reaction related to Kava. It's related to hygiene, and you probably find it in any situation where beverages are shared or food is shared. But yeah, I mean, there was a study, getting back to the question of adverse reactions to Kava in traditional context. Many of you are already familiar with this Australian Aboriginal study done in 1998, which investigated the adverse effects of Kava in 39 Australian Aborigines, who are not a group that has traditionally used Kava. And it has sort of been adopted into this group, and this particular group was severely culturally destabilized, you might say. They had a number of public health problems before they started using Kava, including high levels of alcoholism, primarily, bad nutrition, the kinds of other social problems that go along with heavily impacted indigenous groups. But they did look at this group and their use of Kava, and they found that there was an elevated liver enzyme, gamma glutamyl transferase, a marker for potential liver damage, was elevated in heavy users, those who customarily consume around 310 to 440 grams of root per week, which is quite a high level of consumption. And among this group, the women of the heavy users, the women had about half of the GMT activity as men, even among the heavy users. So men seem somewhat more susceptible in this case. But of the occasional users that they looked at, with those who consumed less than 100 grams per week, only one of 6 occasional users showed elevated levels. Maybe if I, excuse me. Is that it? I was just thinking if I move this back, and I can't really move it back because people over here can't see. Anyway, this study, which purported to show that kava was having an adverse public health impact on this population, has been criticized on a number of levels. For one thing, it was a small study. 39 people is not really an adequate sample for this type of thing. Many of the men in the study had a previous history of alcoholism, which is not surprising, and this may explain why they had a more activity of this liver enzyme than the women. And many of the men and the women had evidence of hepatitis B. 41% of the men and 15% of the women had hepatitis B surface antigen. And half the men showed antibodies to hepatitis, and 78% of the women did. So this is a population that already has compromised liver functions or is at risk for liver disease. So it's not clear that you can draw much conclusion from this study. But up until recently, this was one of the few that was done. And in terms of their susceptibility to hepatitis, there was no difference between kava users and non-users. So this study came out in 1988, and it was some indication that maybe in certain populations, perhaps those with history of alcoholism or at risk for other types of liver diseases, there might be a problem. Well, of course, in Europe, in the non-traditional situation, kava is now a phytomedicine, as we call it, which is an herbal medicine masquerading as a pharmaceutical, if you will. They are produced according to pharmaceutical standards. The extracts of kava that are used in phytomedicine are much more highly concentrated than anything you find in traditional preparations. It's been known for a long time in Western medicine. It's been in the U.S. pharmacopoeia since 1950. And now, phytomedicines are widely sold in Europe as prescription, well, until recently were, anyway, as prescription drugs or over-the-counter drugs. And in our country, they're sold in health food stores as dietary supplements. And as I say, most of these are organic solvent extracts. Some are standardized. Some contain up to 70% kava lactones. They're really pharmaceutical preparations and not herbal medicines in the traditional sense. Also, it's worth noting, many of them contain additional herbs to enhance or synergize the effects, such as passion flower or St. John's wort, California poppy, and so on, to kind of enhance the anxiolytic and sedative effects. This is just a picture that shows some samples of kava dietary supplements and the different forms they come in, ranging from tinctures to capsules to pills, usually. And this just lists some of the phytomedicines that are found in Europe and what they're for, the different companies that make them and what they're for. Primarily, they're for anxiety, for restlessness, for stress. Some are from urinary tract infections. I don't know if there's good clinical evidence for that, but there's good folk evidence that they're good for that. So that was kind of the situation until about late last year, and then there began to be concerns raised about the potential hepatotoxicity, the liver toxicity of these kava phytomedicines. There was a report published in the British Medical Journal about a 50-year-old non-alcoholic man who was taking a commercial kava extract made by one of the large European manufacturers. He was taking 210 to 280 milligrams of kava lactones per day. He was admitted to a hospital with elevated levels of these liver marker enzymes and other evidences of impaired liver functions. He found no tests. He was tested for viral infection. That turned up negative. He had no history of alcoholism, although he was not a teetotaler. Within a couple of days following admission, he developed encephalopathy, and he needed a liver transplant. And then bioassay autopsy of the old liver displayed what they termed extensive and severe hepatocellular necrosis, basically degeneration of the liver cells. And the authors of this study attributed the effect to Kava based on the lack of viral infection, the fact that he was not alcoholic, and the fact that the disease chronology coincided with his taking Kava. But it really didn't demonstrate a cause and effect relationship. In other words, the piece of data that's lacking here is what kind of shape was his liver in before he checked into the hospital or before he started taking Kava. This is what we don't know. Yes?
Does anybody have any idea of how much Kava you have to drink in a traditional manner to get that level of cavalactone?
1 cup.
1 cup. This is a small amount.
Okay.
Yeah, I think a usual shell, correct me if I'm wrong, Vincent, is about 250 milligrams of cavalactone. And they will, people traditionally will take 4 or 5 of those in a night, you know, customarily. So the amounts of cavalactones that are in these phytopharmaceuticals and the amounts that the American Herbal Products Association recommends you take are a lot less than it is traditionally taken. Yeah. So there's a temporal association here with an incident in one person who had liver problems. There's a temporal association. That doesn't prove that Kava caused it, but this was sort of where the initial concerns were raised. Well, since then, there have been about 33 case reports of liver complications attributed to Kava consumption, starting in Germany with the German federal health authorities and also then in Switzerland. And 32 of these cases were related to consumption of these standardized, highly cavalactone-enriched phytopharmaceutical extracts. Only one of the cases was related to the powdered extract prepared traditionally. And in this case, there was evidence of elevation in this GMT enzyme measured in a group of heavy users. It did not show that it caused hepatotoxicity or liver disease. It just showed that this marker was high. And these markers do not necessarily mean that liver disease or liver damage is present. It means that it should be monitored. There may be a problem, but that's all they are, is markers. And there was also questions on the complicating factors that have led to these case reports. I'm always amused in the scientific literature the difference between a case report when a physician reports in a letter to the editor an adverse effect of an herbal drug. That's a case report. But when an herbalist reports a beneficial effect of an herbal drug, that's an anecdote. You know, and usually they're about the same. But so, anyway, the remaining cases, 30 of the remaining cases, were evaluated by the Traditional Medicines Evaluation Committee of the American Herbal Practitioners Association. And they found that there were a number of complicating factors that make it hard to attribute these adverse effects to Kava by itself. In some cases, they were not taking Kava. They were taking synthetic kava by itself, not a whole extract. Some patients were taking contraceptives or hormones. These are compounds known to have effects on the liver and may be associated with liver toxicity. Other patients were taking prescription pharmaceuticals of other types. Some patients were taking medications not known to be associated with liver toxicity, but which may have had an impact. Some were alcoholic or had a history of alcoholism. In one case, there was an overdose of alcohol also associated with the Kava. So after you winnow all this out, basically there were only 2 cases left that have any degree of credibility. In both cases, the patients were taking no other drugs. They had no history of alcoholism, and they had elevated levels of these liver enzymes. And there were complications serious enough to require liver transplants. In both of these cases, the patients were taking more than the recommended dose. But as we've seen, recommended doses traditionally, or the doses commonly taken, are much higher. Well, now we sort of come, I guess, to my little rant before we get into the details. But you know, so of course, when these reports surfaced in the media, with typical lack of responsibility and inattention to the nuances of a scientific issue like this. I mean, I hate it when the media reports on science, because science is complicated, and the media is not. The media looks for headlines, and you know, they don't. I don't know if any of you were familiar with the recent report that came out in the media about St. John's wort. The headlines appeared all through the states. St. John's wort was ineffective for treating depression in NIH study. This was in the New York Times and many large media outlets, and this was talked about a great deal. What you didn't learn, the drug that they compared it with was a standard antidepressant. I believe it was Zoloft or Paxil. Maybe it was Paxil. That was the drug that was the control, the FDA-proven drug for depression. But you didn't learn until about the 6th or 7th paragraph that drug also was ineffective in the study. So what you saw was the headline, St. John's wort ineffective, and if you read down to the 6th paragraph, you found Paxil was ineffective. What you conclude from that, if you know anything about experimental design, was it was a lousy study. It was a poorly designed study. But how is the media going to report this to people who are not specialists in this field? So the media, you know, loves to sort of beat up on herbs to create excitement, and then when some report comes along, they just as eagerly trash them. So thanks to these inaccurate reports, there was a hysteria created basically about kava. My God, kava is going to poison your liver. You know, this is a terrible thing. All of the complicating factors, the factors that the evidence for this kava toxicity in this very limited group of people, most of whom had other drug or alcohol complications, this was not really discussed. So as a result, kava's acquired this reputation as a liver toxic herb, and it's impacted certainly the Hawaiian kava industry and throughout the Pacific. Well, so as a result of you know, these reports, governments have begun to move to restrict kava or even ban it entirely. The German health authorities, the German regulatory agency, initially called for warning labels on kava. Then they said it could only be sold as a prescription drug. Then they said, oh, we'll just take it off the market completely. Switzerland essentially followed suit. The United Kingdom has proposed legislation to ban it, and they've also requested sellers to put out voluntary warning labels. Ireland has pulled it from the market. So far, the FDA in the United States has not called for the banning of kava. They've said that manufacturers voluntarily issue warnings. They say, to their credit, they say that the evidence does not support the banning of kava. There's not enough evidence to really argue that it should be taken off the shelves. Various other organizations, Council on Responsible Nutrition, which is a trade group in the herbal industry, has issued safety warnings, and the sister organization to this, the American Herbal Council Association, has said they stand by its safety. I mean, they essentially say they have published a large safety review a couple of years ago, and they say there's not evidence to indicate that it's unsafe. I guess the most draconian development, Singapore has banned the sales and importation of kava and classified it as a poison. Anyone selling or importing kava into Singapore faces a $10,000 fine and/or 2 years in jail. In the article I read, they didn't say whether flogging was part of that regimen or not, but anyway, as some of you may know, kava is probably the best herbal alternative we have to benzodiazepine type anxiolytic tranquilizers. And there has been a paper comparing the risk of liver toxicity with kava to benzodiazepines, and found that benzodiazepines are potentially much more liver toxic. But guess what? Kava doesn't have the pharmaceutical cartel behind it, so it doesn't have quite as strong a constituency. The adverse reaction reports to kava, if you compare them to the number of daily doses, it's about less than 1 case per 10 million daily doses. Kava is quite popular in Europe, and so that's probably less than the incidence of liver disease in a population which does not take any of these things. Well, so that's the evidence for kava hepatotoxicity is kind of shaky. The media has been irresponsible. We really don't know if there's a problem or not. And I think in this group, and my contention is that it's been blown way out of proportion. You can't account for individual biochemical variability, but as a group or on average, kava prepared the traditional way is not a risk to the liver. However, having said that, now I'm about to present Dr. Chen's and Dr. Ono's new data on hepatotoxicity. This is interesting work. What it means, what its relevance is to the commercial situation, I'm not sure. And I'm also not sure that I can explain it in a way that you can understand it, or even I can understand it. But what is interesting about their work is not only does it identify a potential problem, it also identifies a potential solution to it. And it started out, they have isolated 2 new kava lactones, these kava lactone epoxides. These are not the alkaloids. Klaus earlier was talking about the epoxide alkaloids, but these are kava lactones. They don't contain nitrogen. And they found this in an extract of kava root from Vanuatu. They're pretty sure that they're not an artifact of the extraction process. They're not an oxidation product of the extraction process. They're actually there because when they did a chemical oxidation of these compounds, these were not picked up. And they speculated that the precursors, just looking at the structures of these things, for these 2 epoxides are the compounds yangonine and desmethoxyyangonine. As you can see, just the only difference is that this double bond here becomes oxidized. And I'm not a chemist, by the way. I just play one on TV. Yes?
Can I add something at this point?
Absolutely.
This paper can be divided in 2 parts.
Right.
The first part is identification of these 2 new epoxides in kava, which is a derivative of the kava lactones. The amount in there, I made some calculation, is very small. 1 kilogram, they isolated 1 milligram. And the other compound is the yangonine derivative.
Right.
The other one is the desmethoxyyangonine is 3 milligrams. So adding up, it's total of 4 milligram out of 1 kilogram.
Right.
Which is 200,000 of the kava lactone level.
Right.
So it's a very minute amount. Normally you wouldn't see it. Okay, this is another.
No, this is a good point. Well, do you think that these things are artifacts, or do you think they're really there? I mean, they're really there, but are they artifacts of the extraction process?
It depends. Right. Epoxides are formed by oxidations under certain conditions, especially if you have catalysts. proper catalyst.
Right.
So it could be artifacts, but there definitely a need of more work on this point to prove it is not a artifact. But then whether it is an artifact or not artifact, if you want to relate it to liver toxicity, it's the second part of the work, is to derive epoxides from the liver homogenate, which they also work on.
Right, right. And I'm going to talk about that as well. They were, as CS pointed out, there are very low concentrations of these epoxides in this route, and they were puzzled to find them. And the suggestion that because if they'd been there before, they would have been found by now, you would think. Their suggestion was that these are phytoalexins, that phytoalexins are compounds produced by plants, often in response to stress or as a result of infection by pathogenic microbes. And it's well known that certain vegetables can produce phytoalexins, and they often have epoxide or aldehyde type moieties or other reactive groups. So they suggested that maybe these kavalactone epoxides reflect a plant that was infected, basically, that it was a defensive compound, and that it was unusual that it would be there. And they suggested also, they discussed an epoxide formed from aflatoxin B1. Aflatoxin is a mycotoxin that often occurs in pathogenic fungi that will infect vegetables. And aflatoxin B1 can be metabolically transformed to a more toxic epoxide form. And the enzymes that are responsible for this are the so-called cytochrome P450 enzymes. These are the drug metabolizing enzymes in the liver that are responsible for detoxifying most of the chemicals in our food and in the drugs that we may ingest, or any foreign compounds. And there are many isoforms of this P450, many different kinds, and they're inducible in the liver depending on what kind of chemicals the liver is exposed to. So it's not just that they're there, they can actually, their profile can change. So as CS pointed out, their next question was, can the liver enzymes activate kavalactones into these epoxide forms, much as it will do with aflatoxin? The liver enzymes will convert aflatoxin to this aflatoxin epoxide. Does it do the same with the kavalactones? So they incubated individual kavalactones in liver homogenates and then tried to isolate the epoxide. And they couldn't do it. They found that they were not produced in that situation. So this isn't a liver metabolic activation of the kavalactones. Yes?
This is kind of a stretch, but one of the things that they say that kava can do is that if you combine it with other chemical compounds and like alcohol and different things, it accentuates whatever you're experiencing or amplifies it. I'm trying to think of how to say it, but in this framework you're talking about here with the liver, things you were just talking about, the thing in the liver to help assimilate and to get rid of things from all the different medicines and toxins we take in already. Could it be a side effect or effect of the AVA that it's the presence of the toxin is already there by accumulation of all these other toxins we take in, and when you do the kava, then it would amplify the toxins that are already there. Is that?
Well, sort of. Have you read the paper already?
Parts of it.
Have you read this paper? The reason I'm asking, what you're talking about is kind of similar to what they are suggesting. Let me go on, and you'll see where. I mean, it's a good question, and you'll see where it fits. But they found, at least as far as these liver homogenates are concerned, that the P450 did not produce these things. So this is just, so then they tried some oxidation reactions under what they called biomimetic conditions, and I'm not sure what makes them biomimetic. These were just in vitro experiments in glass, not in liver homogenates. And they found that under these biomimetic reaction conditions involving hydrogen peroxide, iron, magnesium, and incubating at room temperature, they could take desmethoxyyangonine and they could form this epoxide product from it. And they felt that this was an important result. Again, I'm trying to interpret what somebody else says about their own work. But they felt that it was important because an iron 3 hydroperoxide enzyme, iron 3 hydroperoxide intermediate was identified as a key intermediate in the catalytic cycle of cytochrome P450. So in other words, what they have done in the test tube experiment, this in-glass experiment, mimics what it's recently been found is going on in the liver. So they felt that this was a biomimetic reaction. And another piece of information they found that we mentioned that there are many isoforms, there are many different types of P450, and these can be induced by different chemicals such as ethanol or oxidative stress. They can induce this particular isoform, CYP2E1, it's been given this name, and an isoform that's involved in the metabolism of many drugs and toxins. And it can produce these reactive oxygen species. Reactive oxygen species is kind of a generic term for oxygen byproducts of metabolic reactions that can then go on and affect other constituents of a cell, like membranes or nucleic acids. Oxygen radicals is one example, things that can damage cells that are byproducts of metabolism. And this enzyme can activate many toxicologically important substrates, many drugs. And they have found that of the 30 reported cases of Kava toxicity, 18 of them were in patients who used alcohol or prescription drugs known to induce this enzyme. So this gets back to what you were saying. In a sense, these patients' livers were already primed to produce the kava-lactone epoxide because they've been previously exposed to other compounds, other drugs, or alcohol that had induced the formation of that enzyme. So it's sometimes there, it's sometimes not there, which may explain the variability. So they thought, here it was, it's on the slide. Basically, the concomitant use or the previous use of alcohol or prescription drugs then set their livers up to produce the epoxides in what amounts we don't know, but possibly significant amounts, by inducing the formation of these P450s. So this just shows, what does it show exactly? So this goes on to the next phase of their work, where they found that under these biomimetic conditions, they found that certain of these kava-lactones can form the precursors to the epoxides. That cytochrome P450 from human liver can transform kavain into desmethoxyyangonine, which then through several steps can go to these epoxides. But it does not do it for dihydrokavain. And the only difference between these two is this double bond right here. Similarly with this, methysticin will be transformed to 5,6-dehydromethysticin, which then can form the epoxide. But the corresponding compound where the double bond is lacking, the reaction doesn't happen. So that was another aspect of their work. They felt that the liver might be capable of transforming these relatively innocuous compounds into these, which could then be transformed into these epoxides. And CS, you've read this paper. If I'm making mistakes here.
Right. Yeah, it's in other words, there are specific dehydrogenases that can take two hydrogen away
exactly.
to form yangonine. The non-guanine is active. In terms, it's capable of being changed into epoxides.
Into the epoxides.
Yes.
So the liver primed, I guess the relevance of this is the liver primed with these P450 isoforms can form these things into the precursors to the epoxides. And this may or may not go on, but this is a reasonable hypothesis. So another point of this, so those with this double bond in this key position can be transformed to these precursors. If they don't have the double bond, they can't be converted. The good news is, from a pharmacological point of view, kava lactones which lack this double bond are still pharmacologically active. If you sacrifice the double bond, you don't really sacrifice the activity. In fact, you may enhance it somewhat. So they've suggested, and again, I don't know how practical this is on an industrial level, industrial scale, but they suggested that there may be a solution to the toxicity here, if there is in fact toxicity, which we contend there isn't, but they suggest that you can hydrogenate kava extracts under certain conditions, and you can convert the epoxide precursors, these double bond containing kava lactones, to the dihydroderivatives. You can also, as a beneficial side effect of this, you can convert these colored compounds, the flavocavanes, which are the cause of the dermopathy, the kava dermopathy, to colorless derivatives. So that's just a kind of an additional benefit. But essentially, by hydrogenating these extracts, you can inactivate, or you can convert these compounds which might form the epoxides into inactive precursors. And this, again, just shows what this process is. You start with kavane and you subject it to this condition, catalytic hydrogenation over palladium. We don't need to get into the details. You end up with something which lacks the double bond, in this case dihydrokavane. Here, same thing. Methysticin, you end up with dihydromethysticin. So you've inactivated this liver activation mechanism. You've rendered it impossible to form these epoxides. Also, if you subject the epoxides themselves to this hydrogenation process, what happens is you end up with four products, all of which are hydrophilic, all of which are relatively water-soluble and not reactive. They can then be readily eliminated from the body. So if there are epoxides there, and you subject it to this process, you've essentially inactivated, and these would be very quickly eliminated because they're water soluble. So, you know, that's one possibility. That's one possible way to render this hepatotoxicity issue a moot issue. There may be other ways to do it too. Just formulation of kava products for the phytopharmaceutical market. For example, milk thistle is a herb that's well known to have liver protective properties, a lot of clinical evidence for its benefits on the liver. My prediction is that within a few months, if it's not already happened, you'll see kava milk thistle formulas on the market. And that's probably a good thing. I mean, it's possible to come up with a kava extract that's actually good for your liver. And that would be an interesting market spin. There is another issue here. I hesitate to talk about it because CS called it a scientific fantasy earlier, and maybe we've enjoyed enough of that. But there is evidence that glutathione is the body's own natural antioxidant. It's a tripeptide. It's present in animal tissues, and it's very much involved in our own cycles of oxidation reduction. There is some evidence that traditional kava preparations contain a lot of glutathione, and there may be enough in the traditional preparations that essentially it has its own built-in liver protectant. But when you subject when you manufacture kava extracts using high levels of alcohol or even organic solvents, you lose the glutathione in the extract. You keep the kava lactones, but the glutathione is gone. So then you've essentially taken away that constituent that protects the liver. This just shows an example. I mean, I don't know if this is a reasonable idea. I was talking to Gary Henderson at lunch, and he was saying, but glutathione is everywhere, and we get it in all kinds of food. That's true, but some of the people who are at risk for liver disease from kava, one of their problems is poor nutrition, and they may actually be the ones who need glutathione in their kava. This chart just shows that as you increase the percentage of ethanol in the solvent used to extract kava lactones, basically you lose the glutathione. You get more kava lactones, but glutathione goes away. So, you know, this paper has not been published, and I don't. Guess that was it. Okay, so that's what I know, and
Considering the complexity of the issue, I think Dennis really did an excellent job in interpreting this. And I want to suggest that we hold any questions until after Vincent LeBeau's presentation, because we are going to have a little panel discussion where you can